Hello everyone, this is the Digital Health Voice, a collaboration between MedTech World and Digital Health Malta. Today, we have Dr. Monika SONU, who is the CEO and Director of New Product Development at Health Innovation Toolbox. She comes to us as a medical doctor who has taken the leap and jumped into the field of healthcare technology. She comes with a wide variety of experience from different industries, and I can't wait to start the conversation with her today. So hi, Dr. Monika, tell me, what brought you here today? Where did your digital health journey start?
Thanks for the question, Stephen. Last year has been really harsh for all of us. Most of us, I would say, restrictions, lockdowns, regulations. It all took a great toll on all of us personally, professionally, and right now what we can see is like the world is moving to opening slowly. I would say rather to the normal. I hope so. I hope for the best. So we are all um, headed. This is how I would represent it. We are all headed up for the hashtag hottest health tech event 2021, that is Malta Tech World, which is happening from 18th to 19th November in Malta. And I'm super excited to be part of the panel discussion where we will be discussing about healthcare moonshots and which is like what exactly the healthcare would look in the year 2030 and how we need to prepare for it, how we, what are the opportunities, what are the challenges, and how we all as a fraternity, as industry experts and, cross industry ideations, how we are going to, tackle all this and fruitify, the usage of technology and specifically the emerging technologies in healthcare to, see the face of healthcare that we all are dreaming of actually. Yeah. So this is something we are on the common platform with a common mission. So this brought me here, Stephen. Your question about the digital health, my interest in digital health. So my interest in digital health goes back to almost 2010, like almost a decade back.
Wow, some time ago.
Yes. So I wanted to move into this lesser known territory, and believe me, it was not easy being a doctor. I hope you
For sure.
you
Yeah, we,
feel.
we were like the weird
Yes,
ones, the ones, oh,
yes.
like he's interested in
Yes,
technology.
yes. So this was
Uh,
this tipping point, Stephen, where I felt that I needed to contribute differently to healthcare. Okay, and I was inclined to, things like digital health, health tech, technology, and how what is the the potential of technology to bring change in healthcare. So I grabbed. I was not prepared, of course, for that. So I grabbed some more education apart from what we learned as medicals. So I took a sabbatical for almost 3 years. Okay, and now this was new exercised me with all the tools possible to tackle this digital health and health tech domain. I worked cross industry, tried to learn, experiences and, technology, innovation, and, the idea of bringing that to healthcare. Okay, so a lot of cross industry work, and as we see that healthcare is, specifically health tech is a burgeoning industry. Okay, so I can say that I'm at the right place at the right time. Yeah, over to you.
definitely, definitely. And I mean, it's very interesting because even I had to do the
Yeah.
transition. But tell me about your transition from clinical practice to management. There's quite a difference, and like when people ask you like, why did you do this transition? If I had to ask you like, why did you stop being working in clinical practice? Like, what happened? Like, isn't it a doctor all about clinical practice? How would you answer them?
Uh, I see a lot of change. We are talking about almost a decade ago, okay, where I would not say that I'm the first one to do so. This was happening, this transition was happening. And well, when I was a clinician or as a practicing doctor, I was lucky enough, I would say that, to explore different working environments, different working system. I was not always working in a system which was like well accessorized, which was like too good in infrastructure. We lacked a lot of things. Okay. And I could see a lot of gaps, the gaps which probably tech could save. Okay. So I took some time, Stephen. Okay. And also got deeper into the core operational part of healthcare, the process part of healthcare, the quality part of healthcare, before straight jumping into the technology. So if I would define my transition, it was like from a practicing doctor to a process improvement expert to someone who is so who understands the product fitment to the product design. So this is the way I would put it. So initial years was not an easy peasy switch for me. Yeah. So hashtag doctors are not techies. Okay. So this was the view from the industry at that point of time, and I was working in India. Okay. So I can say that I applied to some of the best consulting firms, health tech firms, startups. Okay. I can't even remember the counts, Stephen. Okay. So, but I felt the industry didn't see my fitment anyway. Okay. At that point of time. So this was when I decided that, I want to be a health tech entrepreneur, create my own niche. So if I see myself today, it's like I work in a highly collaborative manner. Okay. With different teams, which comes from design, which comes from IT, which comes from the product side of it. So I help them understand the healthcare ecosystem, the the multiple stakeholders which are involved in the healthcare, how it brings values to the things in healthcare, and how the data is working, how the system processes work. So it's like kind of a bridge between the technology and what exactly healthcare needs. So I engage in multiple interesting projects, specifically tech projects, and every project is like kind of bring challenge and joy to me, and I am actually happy that I didn't fit in to the industry at that point of time. Yeah.
I think it's all about breaking silos, breaking even the envelope,
Absolutely.
this envelope that has been
Mhm.
created, and like thinking, like looking at all of
Mhm.
this, I really got curious
Mhm.
about Health Innovation Toolbox and Digital
Mhm.
Margin. I really love the website. Like I had to kind of put the cursor. I was like
Good.
scrolling, like you see all these good.
Yes.
So I said, all right, this looks like
Mhm.
some futuristic website. But
Yes.
like keeping that in
Mhm.
mind, uh, tell me more about Health Innovation
Mhm.
Toolbox. Tell me more about the Digital Machina
Mhm.
project. I'm not sure I'm pronouncing it
Yes.
correctly, but
Okay.
tell me more about it. Like, what is the ethos and what is the vision behind your work? Like, what can we learn from it?
Yes. To comprehensively put it, we started back in 2013. At that point, I'm talking about Digital Machina. Okay, it was at that point of time, it was an operations and digital consulting firm, and we were taking our baby steps, towards the technology and the digital transformation, and we were covering multiple industries, Stephen. Okay, so it started with two people, me and my other co-founder, very small office space. Okay. And as I said, I was consulting, we were training in multiple clients on digital transformation, operating model optimization, and parallelly we were taking our baby steps in the digital product design and development in-house. So with time, we came full-fledged in technology for Digital Machina, and we did multiple interesting projects in technology for different geographies and different industries. So this is about Digital Machina. Now, Health Innovation Toolbox is the healthcare wing of Digital Machina. Okay, so 2019, we felt that we need to separate this healthcare wing, which I'm leading, and this move, it kind of gave us a credible foundation to our healthcare vision, the vision you're asking about. So we have been working on the healthcare project since 2015, and um, it was in 2018 that we earnestly thought that this needs to be separated. There needs to be more focus on the healthcare projects, on the healthcare products. So again, the consulting and technology went hand in hand. We have conceptualized and co-created with our partners a lot of multiple healthcare products. Okay, in-house we have our own telemedicine platform, we have our own blockchain based pharmacy platform, end-to-end supply chain pharmacy platform, we have our own conversational AI. So these are some very, very interesting things that we have done so far in healthcare in-house. Apart from that, Stephen, we also do customized health tech projects. Okay, the tech projects specifically, which focuses on the emerging tech. And again, as I said, we have taken a lot of cross industry ideations, across industry things that we try to put it into the healthcare. Yeah, this is what we do for both the companies. Yeah, over to you.
Yeah, so that's quite a lot. And also what really intrigued me is the fact that you did actually start from healthcare, but you had like this wide, and you were looking beyond healthcare. Yes. And I think as health, and as the healthcare industry and the MedTech industry, we have so much to learn from other industries that have already been disrupted.
Absolutely.
So we're looking at CRM, for example, just to mention one, which before was used so much in banking, now starting to be used in healthcare.
Yes.
Because that is, although the processes don't translate automatically, but there is a lot of processes that we can really learn. And keeping that in mind, we've been through a lot, as you mentioned before.
Yes.
And one thing that comes to mind is the COVID-19 pandemic.
Yes.
How has that affected you? Has it closed your doors, or has it opened wide the opportunities? Has it given you many more opportunities?
Yes,
Tell me about it.
Yes, it's a very good one, actually. You know what, Stephen, the worst thing about COVID is like it doesn't hit once and goes away. No, it doesn't do that. It just lingers. It lingers. And
lingers, that's the worst,
if you take it lightly, it can just hamper you, your loved ones, everybody's risk around you. So when restrictions started in India, as we all overnight we were inside our houses remotely working. The team members, most of them moved from the place where we are working to their native places, and travel restrictions are there, and we visit our clients. This is how we do our project. Okay, so we work along with healthcare providers, hospitals in different countries, on different aspects. We talk about design, strategy, technology, everything, and that it requires a lot of walkthroughs. Okay, so yes, these were the setbacks that we faced during the pandemic, but with time, we found out our own ways to continue our business, and synchronously, I would just put it this way, like the pandemic also pushed huge demand for digital health. So yes, COVID-19 interrupted the pace, but not by changing the trajectory of the digital health, but rather it fast-tracked innovation, investment, the mobilization. All these got fast-tracked. Okay, for sure. We have a lot of healthcare clients. Okay, so they started looking for a lot of digital technologies. Okay, the ways so that they can continue their care. Okay, the care pathways and all. They wanted to expand their access of care to the patients, wanted to connect with the patients virtually. So a lot of plug and plays are in demand now. New initiatives taken by these hospitals or the care providers, that provide both the patient-centric solutions, business-centric solutions, preventive, promotive healthcare, all these came into action: remote patient monitoring, program management, EHRs. Okay, so I feel the future looks quite optimistic to us. So we are like, how we are seeing it, like, the COVID thing is like it's increasing a lot of industry collaboration. This is what we are seeing it as. It's happening. It's happening right in front of us. Yeah.
Yeah, we're seeing data scientists working alongside doctors. Yes. We're seeing software developers, like working alongside healthcare management and administration. So really, there's quite a lot going on, and I fully agree with you here uh, how we're moving on. But let's move to the exciting part. So, are you looking forward to come to Malta? Like, what's your plans? Are you joining remotely? What are the plans? Will we see you here?
I'm dying to be there. To be
just try not to die, okay, on the way here. Just come here.
COVID couldn't make me dead, so nothing can. So yes, that was a very bad joke. But yes, I feel that MedTech world, it's like kind of collating people, it's collating innovation, ecosystem, emerging tech, and you have some amazing and awesome line of speakers joining from around the world. So that itself makes this event, I would call it like very unique event of the year. The tracks that all of you have kept is like, it is evaluating the potential for technological innovation. This is how I see it, and we need to discuss it now. I mean, we need a global discussion, and you all are bringing that platform. So, and finally, my most favorite part is it is being organized and curated by a team of doctors and medical experts. So my extra points goes in for that. Always in support. Again, I'll hashtag the hottest health tech event 2021, the MedTech world. Yes, very excited.
Yeah, I think it's definitely like an event to be there. Also because, we have a Mediterranean flavor to give to all of this. And even Malta has been throughout history a place where there is global connections. We're always looking outward. We're not just looking towards our own country, but we're looking towards the world. So, just to summarize our lovely conversation, I would like to ask you for two main things.
Yeah.
And this will actually be asking to each and every interviewee. You are one of our very first, Dr. Monika.
Thank you so much for that.
Dearest colleague. And I have one question for you. What is your take-home message, your like one-liner to summarize this whole conversation? And also you have the opportunity to raise awareness about a special topic which is close to your heart. The floor is yours.
I just, after all this COVID and the pandemic and, the paternalistic way how the healthcare works, there is something which I see as a neo-health economy. I call it neo-health economy. So I would say that, healthcare is gonna go for a huge change for sure. Okay. And we are seeing actually a lot of technology. But as someone who has worked so closely in like kind of every aspect of healthcare, I think it's not more and more technology that is important, but what is important is the right technology, for the right, the fitment. The right fitment is very important. You can bring huge change. I'm just giving you one example. You can bring huge change even with a feature phone based message. Okay, you can create huge ripples in healthcare. You do not always need the most innovative technology, but the most fittest technology for healthcare. And I feel, in this new economy, the companies or the healthcare providers, are the ones, the ones who will make humanity as a differentiator in this age of automation, offer human focused products, services, and innovation, and trigger a positive emotional response, make things seamless, intuitive, will be the ones who will be the winners. Otherwise, it's the game is going to change. The ball is going to go in different courts. We are seeing that. So it's time for us to embrace newer technology with a lot of sense and common sense and commitment. This is what I want to say, Stephen. Yeah.
Yeah, and anything you want to raise awareness on, something, it could be something like within your community.
I feel most of the time in healthcare, we miserably fail to appreciate the front lines. Okay. So, we always talk about technology, we always talk about tech, we always talk about so many people. We talk about patients. I mean, not to take it in otherwise, but we talk everything, but we've miserably failed to address, the healthcare front lines. I mean, they are the soul of healthcare. I think if you want to do anything in healthcare, it needs to be with them. Uh, until unless you disrupt everything and you have AI robots in front of you analyzing you, diagnosing you, that will
Maybe not.
that will come probably. We cannot say.
That
That
will
will
come
come someday.
someday, yeah.
But as of now, we need to respect them. We need to bring them in the tech space. We need to hear their voices. I see huge change. I see acceptance and embracement now. I'm not complaining as such. You have seen umpteen doctors turning into entrepreneurs, not just turning into entrepreneurs, but they are having very, very powerful voices in the industry. So I think, these voices needs to be heard and always heard and kept together if you want to change the ecosystem. This is my message. Yeah.
Yeah, big shout out to all the frontliners here, especially during this pandemic.
Absolutely.
And with that in mind, I would love to thank you, Monika, for being here with us today. And we look forward to seeing you in Malta.
Absolutely.
Like, fingers crossed that everything will
Fingers
go well,
crossed.
everything will be smooth.
Yes.
There is a
Stephen, it was amazing. It was amazing. Honored. I'm honored, and it was amazing speaking to you. Yeah.
Yeah.
Thank
Cheers.
you so much.
Bye-bye.
Bye for now. Have a lovely
See you.
evening.
Bye-bye.
Bye. Bye for now. Yeah.
I will. Cheers.